My name is Karen Liedke, and this is Leah Martino. We are licensed acupuncturists working in the chronic pain department of Kaiser Permanente in Santa Rosa. This short video has been prepared especially for patients with nausea to watch at home or while receiving infusions. Nausea is a common side effect of chemo and radiation therapy. In addition to medication, acupressure can be used to help with nausea while you're receiving therapy. Acupressure is a method of applying pressure to specific areas of the body utilizing acupuncture points and theory. It can be done on yourself anytime, any place, and does not require any special equipment. Today, we're going to be learning how to do acupressure on the ears and 3 points on the body for nausea. All parts of the body can be treated by using the ears. The ear points are arranged as though there were an upside down and curled fetus on the ear with the lobe being the head. Since the specific points are very small, you can massage both ears entirely with more attention to the general regions demonstrated. However, do not worry too much about getting the specific points on yourself. There are 4 main acupressure points on the ear. I will show you where they are on Leah's ear. The sympathetic point is located here. Shen Men is located here. Point 0 is here. And the liver point is here.
The first point is sympathetic. You locate it with your little finger. It's up under the upper ridge of the ear, and you just slide along that ridge. And sympathetic helps to relax the nervous system. Next, you want to just slide your finger down to the top of this triangular fossa. This point is called Shen Men Spirit Gate. It helps to alleviate stress. The third point, and the most important, is Master Point 0. It's located directly in the center of the ear. You just move your finger along that ridge, and this helps to regulate the function of the stomach. And the last point is liver. You just slide your finger out and along this inner ridge. And liver helps bring the whole body toward balance. When you're done with those, you want to massage the whole ear. You can start with the bottom. This is the head area. And you move up the body to the neck and the shoulder. And the top of the ear on the outside has to do with the hips and the legs. And then you want to make sure you massage the inner ear. The lower inner ear has to do with the respiratory system. The middle of the ear has to do with digestion. The upper inner ear has to do with urogenital. You want to massage the front of the ear and the back, and do it until everything is rosy red and warm.
Next, we will learn 3 points to use on the body for nausea. You will need to access the area by your wrist, the area below your knee, and 1 foot. A very important point for nausea is located 2 of your finger widths above the wrist between the tendons. This is called neiguan in Chinese, or inner gate as translated. Try finding this point on yourself. Motion sickness wristbands are meant to press on this same point. They can be purchased from a pharmacy or sporting goods store and worn on the wrist. Another point that is good for digestion, immunity, and the whole body is called Su San Li, or leg 3 miles. It can be found by resting your thumb above the kneecap and letting your index finger land 1 finger breadth from the bone on the outside of the leg. Try finding this point on your leg now. The last point we will learn today is called Tai Chong, or Great Pouring. It is located in the web of the foot, between the first and second toes, 1 inch from the base of the toes. This point complements inner gate for nausea. Practice locating this point on your foot now. So far, we've learned the location of the points. Next, let's learn a little bit about the technique. Start out by holding each point for 30 to 60 seconds. Follow this by massaging in a counterclockwise direction for just a few seconds. You can alternate which points are used on given days. You can use the points many times in one day. Now, let's try doing a whole treatment on ourselves. Start with the ear. Press with your finger into each of the 4 points. Sympathetic, Shenmen, Zero, and liver. At home, hold pressure for 30 to 60 seconds on each point. Then massage the entire ear. Next, press inner gate for 30 seconds. Then move your finger in a counterclockwise direction on the point. Find the depression below the knee. Press leg 3 miles for 30 seconds. Then move your finger in a counterclockwise direction on the point. If you are unable to press into the point due to hand pain or weakness, use an object such as a wooden spoon. The final point is great pouring. Find great pouring on the foot and hold for 30 seconds. Then move your finger in a counterclockwise direction on the point. Thank you for watching this video. Acupressure is a simple tool to use during your therapy. Remember to use acupressure when you experience nausea.